All right, right now, hospitals across the country are having trouble finding nurses to fill open positions.
But experts are saying if the nursing shortage is bad now, chances are it's going to get much worse. Michigan nurses are dealing with unprecedented problems and shared some of those complaints with Jennifer Ann Wilson on her Facebook page, including abusive language by patients, poor pay, and poor hospital conditions.
Now, according to the U.S. Bureau of Labor Statistics, the United States will need another 1.1 million nurses by the year 2022.
Tonight, 7 Action News reporter Jennifer Ann Wilson taking us in depth and a look at how bad Michigan's staffing shortage truly is.
And if there's a solution in sight.
In the nursing industry, like every other industry currently facing a shortage of workers, experts say companies need to listen to their current employees and better understand what's happening in the community around them.
I've been a registered nurse in Oakland County for 7 years. In the worst public health crisis in 100 years, hospitals let us down.
The Michigan Nurses Association released this video to lobby for new legislation to limit the number of hours registered nurses are forced to work and the number of patients they are assigned.
Nurses are left on their own, working 16-hour days, fighting an endless battle to keep our patients safe. People's lives are at risk, and it needs to stop.
The Michigan Health and Hospital Association released a statement in response that says, in part, the MHA believes hospitals need to have the ability to choose the staffing models that best fit the individual needs of their patients and communities. But the Nurses Association says that's not happening. So how bad is Michigan's nursing shortage? According to the Bureau of Health Workforce Database, the states in green have more nurses per capita than Michigan. There are 29 states seen in gray with the same or fewer nurses per capita as Michigan has. And travel nursing agencies are feeling it.
We're seeing a high level of burnout. Hospitals are seeing, I think, their highest vacancy rate in several years. At the beginning of the pandemic, we had about 6,000 clinicians on assignment. We more than tripled our clinicians on assignment in the past year. So
Wow.
It has been a very, very busy year for us as a company.
Surprisingly, the number of people applying for nursing licenses has increased in the state of Michigan by more than 1,000 when you compare the first 6 months of 2020 to the first 6 months of this year. The Michigan Nurses Association says there are 165,000 licensed nurses in Michigan, but only 125,000 nurses working in Michigan. So where have all the nurses gone?
We're getting roughly 350,400 job views per week on our platforms.
Some nurses actually messaged me on Facebook telling me they'd left local Michigan hospitals to take a traveling nurse position for better pay and better working conditions.
We were seeing over $10,000 a week in certain areas.
Pay is definitely not that high right now, but while Michigan hospitals can still legally require their nurses to work mandatory overtime, travel nurses are governed by agency contracts.
It's based off of the terms that we discuss with the facility. So a facility can't necessarily mandate that anybody is required to stay.
At Aya Healthcare, their database of travel nurses has grown significantly, and staffing requests from hospitals are increasing too.
I saw 26,000 last week. This week, I literally just checked our numbers again. We're seeing over 31,000 traveling jobs available right now.
The Michigan Nurses Association believes passing a law to get rid of mandatory overtime and setting patient-to-nurse ratio limits would make hospitals a safer and more appealing place to work. Annika Gross, CEO of Detroit Future City, an economic development think tank, says solutions are often found by listening to employees and understanding the community.
The vast majority of head of households in Detroit are single working women.
The majority of nurses are women too, but it takes training.
Having accessible access to technical education that can get you on that ladder is a privilege and a benefit that not a lot of people can afford. So I think that, there's some work that needs to be done. You can't just say there's a nursing shortage, so now you should be a nurse. There has to be a whole system around that helps to promote and advance.
Legislation similar to the legislation that the nurses union is advocating for has been proposed several times in the past, but never yet made it through. I'm Jennifer Ann Wilson, 7 Action News.
All right, thank you so much, Jennifer Ann. Now, to hear more from nurses on the front lines about their experiences during COVID and what hospitals are doing to try and retain their staff, make sure you head to our website at WXYZ.com.